Sir, we are
सर
live
मेरा
now.
जो या
Hello everyone, I am Dr. Saurabh Taneja and I am representing team Conceptual Anesthesia. And today is a very special day for our journey in Conceptual Anesthesia. Our very own Dr. Rajat Sharma has qualified with a very high rank in NEET super specialty. And he is with us to share his journey, which will be very exciting and insightful to all of you. So here with us is Dr. Rajat. Hi Dr. Rajat, how are you doing?
I'm fine, sir. What about you, sir? How are you doing, sir?
I am doing fine and it is great to see you. Heartiest congratulations from all of us. We are
Thank you so much, sir.
happy.
Thank you so much, sir.
So now we'll hear Dr. Rajat tell us about his journey, how he studied, how he qualified, and we'll ask him some personal questions also. So Dr.
Fine,
Rajat,
sir.
are you ready?
Yes, sir.
So Dr. Rajat, just introduce yourself. What is your current role? What is your background?
Mm. So, myself, Dr. Rajat, as you said my name earlier. So, I started this journey actually in 2011 when I took medical. And after that, I was in Akash Institute. Then after that, I joined my MBBS in 2014 and I did my MBBS from Davangere, Karnataka. And I passed out in 2019. After that, then NEET PG preparation and all. Then I joined DNB anesthesia, and it was very. This decision was actually challenged by so many people that I am choosing DNB over MD at that time. So I thought that if I'm choosing anesthesia, so it should be DNB as because in some government colleges we don't have so much of equipments, we don't have so much of what should I say monitoring equipments per se, and which I found very good in Santokh Badulji Memorial Hospital, which is in Jaipur. So I did my DNB from there, SDMA Jaipur, and so DNB curriculum was very good. And at that time, I felt a need to learn more of anesthesia. So I joined Conceptual Anesthesia in September 2023, actually. And after that, you saw me, I got the rank of 29, and I actually passed the MB with also flying colors. So yeah, it was my journey. And right now, I'm thinking what to do later.
The institute that you did your DNB from is a very established and old one and a very reputed one.
Yeah.
So since the time
Yes,
when
sir.
I joined my MD anesthesia more than 2 decades back, it was one of the reputed,
Mm-hmm.
still is. And I have a lot of friends who have
Yes, sir.
started out from there and who work there. So
Yes,
congrats
sir.
for that, clearing your DNB
Thank
as
you,
well as
sir.
your NB.
Yes, sir.
What initially sparked your
Yes,
interest
sir.
in doing NEET super specialty? Some people just practice anesthesia and they're happy to do anesthesia. At least in our times, most of us were happy to do anesthesia and relax in life. But
Mm.
nowadays, I see students all being ready for the super specialty exams. So, what initially sparked your interest?
So actually speaking, like the very first day of my anesthesia, I started with cardiac anesthesia. My HOD posted me in cardiac anesthesia on the very first day. So when I was in cardiac anesthesia, I was so like the alien kind of feeling at that time that what I'm doing in the OT and the cardiac anesthesiologist, he never used to give me anything. Like you just stand there, observe what we are doing. That's it. Then I used to ask him questions. Then he used to tell me, पहले जनरल सीख के आओ, फिर ये पूछना. Then from that day I thought कि यार like yeah कि I should go beyond and study cardiac things. So I brought the Stolting book at that time and I started to read about heparin, protamine sulfate, and also yeah it was very interesting at that time that okay that what we have read in pharmacology actually we are applying in the patients at that time. And noradrenaline, we are increasing the doses of noradrenaline, we are decreasing the doses of adrenaline at the same time, increasing NTG, decreasing NORAD. All these things were happening at that, and it was so overwhelming at that time. Yes, that I should read about all these things. So the interest actually developed from that, and the institute was really good. And we had liver transplants, renal transplants going on at the same time. So I was in 7 to 8 liver transplants also. So I thought, ki, yeah, I should read out liver transplantation also. So at that time, the interest developed, and eventually I used to read all those things in between the lectures also, and from the conceptual anesthesia also. It actually helped me a lot. Then from basically from the very first day, I thought that yes, if I need to pursue the cardiac anesthesia kind of thing, if I need to pursue the liver anesthesia things, I have to go for DM or fellowships. Yeah.
I always used to tell my juniors who came to me for advice that
Mhm.
anesthesiology is a combination of medicine, physiology, pathophysiology. If you want to learn, you end up seeing all the
Mm.
cases, all the types of medicines, the rare cases when they come to you in the OT. And
Yes, sir,
plus,
definitely.
imagine cardiac anesthesia, transplants.
Mm.
I mean, they also
Mm.
vary. A medicine guy
Mm.
or an average person who does practice medicine will only see one part of that. But as an
True,
anesthesia,
sir.
3 years, we tend to see so many things, and we can actually pick and choose what to do in the later part of our lives.
Yes, sir. Yes.
I would like to ask what all subspecialties are available in the NEET super specialty exam that you cleared, and which one interests you most?
So the subspecialties are transplant anesthesia, cardiac anesthesia, then pediatric anesthesia, and neuro anesthesia. And for critical care, now it's a different exam. But before, the critical care was also in the anesthesia group itself. But I didn't apply for critical care, but I applied for anesthesia group. Then I am more interested in transplant anesthesia, sir. No, I see whether I may take on this rank or not. But yes, I am more interested in transplant, then cardiac, then neuro.
So transplant anesthesia per se is a very upcoming thing, and I
Yes,
would
sir.
actually be great to see you developing into a great transplant anesthesiologist, and hopefully you will get it. And I will obviously connect to you personally about how we can
Mm.
go about it. So I would
Yes,
say,
sir.
for the benefit of the students, can you walk through the preparation timeline? So when
Hmm.
did you start, how did you plan out, and how many average hours of the day that you gave to studies? Obviously, one needs to see WhatsApp, reels, enjoy in life, play some
Yes,
sports,
sir.
but
Yes, sir.
preparation timeline along with these.
True, sir. So, sir, actually, what happened in September 2023, we had our practicals for FAT, like kind of an assessment test, which we used to go outside from the hospital and we used to give the test over there. So I was miserable in that test. So then I thought, I need to do something now because it has been around 1.5 years of my residency has been over, but I need to pick up the things now. And at that time, so only conceptual anesthesia app was there, which was telling us to read from chalk and board kind of thing. The Janvi ma'am was there and she was teaching from chalk and board. It was not slides. Like slides were not reading. She was not reading slides and all. So I subscribed just because of that. And I actually inquired before subscribing that whether ma'am is teaching from chalk and board or it was she was just reading the slides. So they told me that the ma'am is teaching from the slide itself, or this thing, chalk and board itself.
Agree.
Then I subscribed from conceptual anesthesia, and so duty hours were very hectic at that time because we were in second year and we used to go by 8:30 and we used to come by 8:30 in the evening. Then after coming back, I started by bits and pieces, like seeing half a lecture at a time. Then next day, I was completing the lecture. So the journey started from that, and I actually completed some 80% of the lectures by May or June 2024. And after that, I started my preparation for DNP. And my HOD was really helpful at that time, and he gave us the holidays for 2 months around before the studies. So I actually paced up the things from in the last 2 months, and so after that I studied for practicals DNB, and after practicals DNB, after just 1 month we had the exam. So after finishing the practicals, I just solved MCQs from the Conceptual Anesthesia app, and one more book was there, and but the questions were almost similar. So after just solving the exams, solving the MCQs, the exam got cleared, sir.
No, that is great. And I would also like to highlight the other part. So, were you interested in some sports, and how much time did you WhatsApp and the reels do?
My see, I used to go to library at 9 o'clock, and from 9 to 9:20, I used to scroll reels only. Okay, and at that time, World Cup T20, India won the World Cup also. So I used to scroll reels of World Cup also. Then after that, test matches were there. I used to see the test match. I'm really fond of cricket and test match. I used to watch all those things. So
Yes.
basically, if I'm studying from 9 to 1:30, 45 minutes is for social media. 45 minutes for social media, definitely. And after that, 3 to 8, I used to study. And in that thing, also 45 minutes for social media, kind of that. And I never used to study after 8 o'clock. Never.
We definitely need the breaks. We definitely need the breaks. Like social media is providing breaks.
Yes,
Earlier,
sir.
we chat with friends, so nowadays we chat on WhatsApp and we connect on voice text. And also learning to do that.
Yes, sir.
Be older to you. And in my time, we used to read about the books. Nowadays, there are so many resources that are available on the net, including the conceptual anesthesia
Hmm.
app. And in the
Hmm.
app, trying to incorporate more and more MCQ based questions,
Yes,
explanation.
sir. Yes, sir. Yes,
It is
sir.
for the candidates to actually
Hmm.
that if we cover a MCQ and a topic simultaneously, the whole
Hmm.
topic, and when
Hmm.
somebody teaches you with his own experience, it is even better. Obviously,
The best, yes, sir. The best part of the app is the evidence-based medicine is there in the app. Whatever topic if we are studying with all the evidence. If the article is there, the article is there in the app. So we can search the topic hemodynamic monitoring, and if like role of cephalosporins in ventilator-associated pneumonia, whatever it is, the and the questions are also asked in DNB. This kind of questions are also asked in DNB, and the app was including all those things, and it actually helped in the later studies also in NEET SS.
so thank you for the kind words. So I just wanted
Yes,
to
sir.
know, did you make a weekly routine, or did you make a monthly routine, or did you follow a daily routine? Just for
Sir,
the benefit.
weekly routine. Sir, weekly routine, because I know that the duties are so hectic that we cannot follow the routine beyond a week. Sometimes we cannot follow the routine even for 2 days. कभी कोई emergency आ गया, कभी कोई emergency आ गया. Again, we have to go to the OTs. We have to again we have to go to the OTs. We have to manage the cases. Then again we have to come back. The energy is so drained, sir. So we cannot study every day. It's like I just want to tell the juniors that okay, relax. Duties, do the duties, learn anesthesia, then apply that anesthesia with the books. Then only they can love anesthesia, then only they can learn anesthesia, because it's a totally different subject from medicine and all. So we need to go to OT, apply the things in the OT, then come back to the room, study if they can. If they cannot study on Sundays if they are not on duty days.
So, like, I work in a ICU, so I always
Hmm.
tell my for the past decade and a half,
Hmm.
whatever case that you have seen in the ICU, whatever
Yes,
case
sir.
in the ICU,
Hmm.
just go home, or even in the ICU when you get a time off, just
Hmm.
spend 5 to 10 minutes. Even if you have books online, you have an app, you can actually search on the net.
Hmm.
If the case and simultaneously read about it
Hmm.
and get the case again, that is the
Hmm.
best preparation that you can have for your whole lifetime.
Yes,
And
sir.
and it goes on to, it's a layer of knowledge that you add up, another layer of knowledge. So it
True,
is a
sir.
ending there only. So
Yes, sir.
then for a lifetime actually.
Yes, sir.
So what are your top two or three pieces of advice that you would, in 2 3 lines, that you would give it to future aspirants who would like to give the exam maybe next year or the
Hmm.
next time?
Hmm. So the point is, go and work in the OT and embrace the learning in the OT, then come back, read from app, read from book, but do not be so overwhelmed in this NEET SS thing or MD things or DNB things. Study only if they want to at one point of time, and enjoy the life as much as possible, sir. Because anesthesia is the only branch which gives us the, I guess so, it gives us the, what should I say, it gives us another opportunity to enjoy the life, because we sometimes we get free at 5 o'clock, sometimes we get free at 3 o'clock also. So just enjoy the journey. Everything will happen. I know that everything will happen.
So when I'll tell you my time when I was picking anesthesia, I asked my
Hmm.
seniors, and it was way back in 2004.
Hmm.
So they told me that the best work-life balance, and they were talking in 2004
Yeah.
about,
Hmm.
is in India. So that
Hmm.
was what seniors told me, and it is actually there. You sometimes get
Yeah.
free at 2:30, sometimes it's six
Hmm.
o'clock. But
Hmm.
if the surgeon is operating on a difficult case, you're standing, you're learning so much.
Yes. Yes,
You
sir. We are learning. Hmm.
have medicines that are acting, what medicines you are giving.
Hmm.
If you actually pay enough attention to all the different subset of
Hmm.
cases,
Hmm.
you will learn a lot. That
Yes, sir.
learning stays forever.
Hmm. True that, sir.
Nothing like a good residency. Nothing beats like a good residency. You
Yes, sir.
can
Yes, sir.
so many practical questions because of that
Hmm.
also.
Hmm. Hmm. Like if the case of postpartum hemorrhage is there, multiple blood transfusion will be there, and come back to the room, read about PPH also, and read about multiple blood transfusion also, massive blood transfusion also. So both of the topics will be covered, and these are the only questions which will be asked in NEET SS. So
Even I guess during your even the whole of life when you practice anesthesia or any subspecialty, such kind of scenarios will appear again and again and again.
definitely, sir.
Like massive,
Definitely.
and if you practice transplant anesthesia, you will have a lot of.
Exactly, sir. Even in neuro anesthesia also, even in transplant anesthesia also, even in cardiac anesthesia also, these topics are asked again and again, sir. Hmm.
and you will have patients of the same. So actually, you will be
Yes, sir.
benefit lives if you
Yes,
really
sir. Yes, sir.
know about
Hmm.
them
Yes,
and
sir.
latest gadgets, investigations that are coming. So once you know about the
Hmm.
subject,
Hmm, hmm.
add up like Teg and Rotem are coming, and you can actually
Yes, sir. And so we had, you see, I was in liver transplant case only, and first time I saw the tag. And when I saw about the tag, and at that time I had the app. So some 2 or 3 days back, I saw that the class on thromboelastography. I was like, what is thromboelastography? So when I went to the OT and I saw that yes, TEG is there, TEG is this, then on the very next day I came back to the room and I read about tag from the conceptual app only. And the question was there on tech this time. Our time is too long. In NEET SS, our time was too long with the question. I remember, sir.
So actually, I mean, exams. I've been following exams for last 2 decades, all the entrance exams
Mm.
and the exit exams. Most of
Yes,
the
sir.
most of the times, the examiners tend to put clinical scenarios, clinical questions, what are actually relevant clinically also.
Yes, sir.
So once you have teachers who actually practice anesthesia also, and then they teach simultaneously, so they also add their own experience over the years.
Yes, sir. Yes, sir. Yes, sir.
So that adds up actually.
Yes, sir.
Some rapid fire fun questions.
Yes, sir.
Prefer for a break, coffee or tea?
Coffee, sir.
Coffee. And
Yeah.
something else? Coke, no Coke.
Coffee with aloo patties.
Aloo patties, perfect. In our times, we had samosas.
Yes, sir. Yes.
Topic and anesthesia which you know by heart.
Uh, Sir, posterior fossa surgery.
Something you found most difficult. You read it again and again, but still you tend to forget. You have to revise it again at the end.
Inhalational anesthetic.
A guilty pleasure during breaks. Some
Mm. Social media and a chocolate.
yeah, that is very true. So as a
Yes, sir.
last, any advice that you want to give? You've told about how to practice anesthesia passionately and
Mm.
then simultaneously. But
Mm.
any life advice that you want to give to your juniors? Yeah.
Mm. Study hard and don't feel sad in the residency because residency is the best time. And if we are very secured in residency, we can apply whatever we want to the patient if the consultant is helpful. And enjoy the life. And so last thing is, uh, last advice is keep smiling every day. That's it.
That is a nice advice. I will give one advice on my own. So, since I am
Yes,
maybe
sir.
10, 15 years elder to almost all of you, maybe at least. So,
Yes, yes, sir.
life is a test match. Nowadays,
True, true.
watch T20, 100 balls match, etc.
Mm.
Doesn't matter if you qualify on the first attempt, second attempt, or third attempt. In the end, if you do the branch of your choice, 10
Mm.
years down the line, it will all be the same. So,
True,
just
sir.
get satisfied, work hard, play hard.
See, sir, 90% of the people do not take anesthesia because of the choice. They take anesthesia because they don't have any choice. But eventually, 90% among them fall in love with anesthesia when they start to practice anesthesia and when they read about anesthesia. It's really a beautiful subject. I will tell to all my juniors that read about anesthesia, enjoy the working in the OT, and uh, keep drinking coffees because we have that privilege. Then, and do not fight with orthopedic residents because they will anyhow put the case.
And there are so many new subspecialties that are developing. So you
Yes,
will
sir.
develop a niche of your choice. You will develop a subject of your choice as a future career, and you will all do well, believe me.
Yes,
Yes.
sir. Yes. Yeah. Thank you,
Thank,
sir.
thank you so much. It was great interacting with you. It was very fun interacting with you, and may you get the field of your choice and succeed in your life. Yeah.
Thank you so much, sir.
Thank you, Rajat.
Thank you.
Thank you.
Thank you.
Thank you, dear. Thank you so much. Hello. अब सीक्रेट बताता हूँ ना